Hi, I'm Dr. Casey Newmoff, base Public Health Emergency Officer, and I'm here today to talk about COVID-19 screening procedures. The 6 Med Group is instituting procedures to make sure that every patient is screened for COVID-19 outside the Med Group before they come into the Med Group. We're trying to do this to make sure that we test all those who may need to be tested for COVID-19 to protect the medical staff inside the clinic and to limit the virus spread as much as we can. The procedure starts where you'll be directed down this first alleyway towards the first tent. You'll be asked a series of questions. You'll have your temperature taken. If your answer to any of those questions is no, and you don't have any of those risk factors, you're deemed cleared and you're allowed to park and proceed into the Med Group.
You have a sticker? Past the barricade, you're gonna park on the other side.
If your answer to any of those questions is yes, or you do have a fever, you are directed into parking lot A. A provider or a tech will come out and ask you some more in-depth screening questions. That may involve doing extra tests, such as a strep throat test or an influenza test. And if you meet any of the criteria, potentially a COVID-19 test. If we do have positive results from the rapid strep or flu, and we can figure out why you have your symptoms, you're free to come into the Med Group. If we deem that COVID-19 testing is appropriate, we might ask you to don a mask and then head home after the sample is collected, so you can kind of seclude yourself at home, not cough on anybody, and await further contact from the Med Group for your test results. This is all done to, again, protect the safety of you as the patient coming to the Med Group, to protect the medical staff, and to limit the spread of the virus as a whole.
At this time, the medical group is open for business and medical appointments are available. We ask for your patience and understanding as these new screening measures may cause some delays in care. I also want to emphasize that these new procedures are necessary to ensure patient and staff safety.